Hello everyone, welcome to Learning Inclusive Academy. My name is Prerna Malik. I am a special educator for children with hearing impairment, and on this channel I will share some practical tips for parents, teachers and future special educators. If you are a parent, teacher or someone who wants to understand hearing impairment better, this channel is for you. Today's topic is 5 early signs of hearing loss every parent should know. Many parents think that their child is simply ignoring them or is a late talker, but sometimes these can be early signs of hearing loss. By the end of this video, you will know what signs to look for and when to seek professional help. Let's begin. Sign 1. Child does not respond to sounds. Imagine you call your child name from behind. For example, your child name is Rohan. You say Rohan, Rohan, but your child doesn't turn around. Sometimes parents think maybe he is busy playing. That can happen occasionally. However, if this happens repeatedly, it may be a sign that your child is not hearing clearly. Also notice if your child does not react to doorbell sound, clapping, loud music, pressure cooker whistles, and someone calling from another room. If these situations happen often, it is a good idea to consult an ENT specialist or audiologist. What parents can do? They can observe their children for several days, talk to other family members, or book a hearing assessment if concerned. Sign 2. Delay in speech and language. Children learn to speak by listening. If they cannot hear sounds properly, learning spoken language becomes much more difficult. For example, most children start saying simple words like mama or papa around their first year, although every child develops at a different pace. If your child is much older and is still not attempting words or seems to have difficulty understanding simple spoken language, it is worth discussing this with a healthcare professional. Early support can make a significant difference. Sign 3. Frequently asking people to repeat. Frequently asking what are you saying? If your child often says what, can you say that again? Or only understand when looking directly at your face. This may indicate they are relying heavily on visual cues such as lip movements, or they are directly uh, aiming at your lips to notice something what you are talking about. Notice whether your child understands better in quiet places than in noisy environments. That pattern can also be important information to share with an audiologist. Real life examples: if you say as a mother, bring your school bag, and the child says what, and the mother repeats several times. Sign 4. Turning the TV or mobile volume up too high. Many children enjoy cartoons or music, but if your child constantly asks for the volume to be much louder than everyone else prefers, or sits unusually close to the television to hear clearly, don't ignore it. It doesn't always mean hearing loss, but it is a sign worth checking. Remember, high volume alone does not confirm hearing loss. Professional assessment is important. Sign 5. Difficulty following instruction. If you give a simple instruction like please bring your school bag and your child frequently seems confused, responds to a different instruction, or only follows direction after you repeat them several times, so pay attention. Sometimes people mistake this for poor attention or stubbornness, but hearing difficulties can also affect how well a child understands spoken instructions. For example, you say bring your bag or close the door, open your notebook. Uh, and the child appears confused. It can also happen in a classroom where the teacher asks a student who is sitting on the front bench and ask him or her to bring a notebook, and the child is slightly confused to what to do. He may bring the bag, a pencil, a book, a notebook, and is confused about what to take out from the bag or what to give the teacher. Why early identification matters? Early support helps with language, learning, social interaction, and confidence. And when should parents seek help? Visit an ENT specialist or audiologist if several signs occur repeatedly. You have concerns about your child's hearing or speech. Quick revision. Today we talked about some 5 signs, the first signs are a quick checklist for your child's hearing and communication. First, doesn't respond to sound, speech delay, frequently ask what, loud TV volume, difficulty following instruction. Now, remember, these 5 signs do not automatically mean a child has hearing loss. Many other factors can affect a child's speech, language, or attention. However, if you notice several of these signs happening constantly, it's important to arrange a professional hearing assessment as early as possible. So, thank you for now. That's all for today. Please like, share, and subscribe. And for the next episode, we will talk about what parents do after they suspect hearing loss in their child. And please leave your questions in the comments. Thank you.